Fantastic. Okay. So first of all, welcome everyone, and thank you for being here. I am absolutely thrilled to be launching in your company the MHO2 funded opportunities. I also wanted to share a welcome and thank you on behalf of Dr. Jenny Shand, who was not able to join us today. So you'll have to do with me for the next 40 minutes or so. I am going to share this presentation, which, as I mentioned before, is currently being recorded and will end up on our website so that everyone can have a view of what we discussed. In the presentation, I will go through four different sections. We're going to talk about MHO in context, so a bit of a brief intro for anyone who's not familiar with the program and the context of the program. I'll then give a bit of information on what we've done during the first iteration of MHO, which was a 3-year-long program. And then I'll officially launch MHO2. And the launch of MHO2 will be initially a bit of an overview of what we're going to be doing, and then a specific focus on the fellowships, which I guess is what everyone is here for. So thank you again and welcome. And for colleagues who've joined us, just a reminder that this meeting is currently being recorded and will be posted on our website. Okay, so MHO is an infrastructure program that is funded by the National Institute of Health Research. And the MHO program has been informed by a very clear and important need for, there you go, a very important and clear need for including a broader range of researchers and participants in the doing and making of research. We are based within the NIHR ARC North Thames, and that is a lot of shrinking names. So I'm going to spell it out. The NIHR is the National Institute of Health Research, and ARC stands for Applied Research Collaboration. So the way in which we work is that we are a bit like a collective of researchers across different institutions based in the North Thames region. So the North Thames region is pretty much from central London, think like Camden and Islington fall within our patch, and we spread all the way up to Essex on the north side of the Thames. And what has emerged over the years is that although we have a lot of active studies in the field of mental health and more broadly, we need to be better at reaching participants. We want to have a broader reach and a broader diversity. And why is that? And that's primarily because having a better reach and a better engagement improves research and also improves the outcomes and the processes of the services and the provisions that are in place to support patients and public. So in reflection to this, the MHO program was launched in 2021. It was a 3-year program. The first year was focusing on understanding the need for training and for engagement to improve participation in conducting and in taking part in research. The second year, we focus on building on what we have learned and developing more opportunities for staff to engage in training, but also a range of different fundings. The 3 fundings that we used to have were the internship, the fellowships, and the Springboard Awards. And then we moved on to the 3rd year, in which we worked on a co-produced event, which we held a couple of weeks ago, and also in developing a stronger network of research champions across the region. We've learned a lot from MHO1, And what was really important in terms of our learning is that a key factor, one of the key factors in enhancing inclusivity and access to research, both in terms of staff and patient and public, is diversifying who is doing research and how we're doing research. And this key learning has informed the way in which we've developed our new program. The other important learning is around time. Time is a very precious good, and we all appreciate that time is finite. But we also appreciate the fact that having dedicated ring-fence time to be able to engage with a task is a key factor to success. And with these different learnings, we've decided to move towards MHO2 to really focus on reaching more broadly and engaging more widely so that we can foster a research culture that is inclusive and accessible, and in which people have dedicated time to engage with their research career development. Before I move on to telling you about MHO2, I thought, what makes a presentation good is stories. So we're going to go into a couple of stories, and I'm going to introduce you to some of our fellows from MHO1, just to give you a sense and a bit of a taste of who they are and what they've been doing. So that hopefully by the end of this storytelling part, you also feel like you can apply and be part of the MHO network. So if you've attended our celebration event a couple of weeks ago, you would have seen the beautiful spotlight wall that we had. Again, a beautiful product of the labor of love of Katie. So thank you, Katie. In the spotlights, we introduced all different members of our amateur network, but today I'm going to introduce you specifically to some of our fellows. Here we have Cara. Cara is a registered mental health nurse, and she became an amateur fellow to advance her research career in understanding how to improve and how to apply and scale up learnings around therapy, animal assisting with her CAMS work. Specifically, Cara works with Peaches, a gorgeous dog. And we've had loads of different activities as part of Cara's fellowship. Cara came in, wanted to understand how to develop this implementation research and how to really target focus. And a key activity in our fellowship was an event, a scoping event with public contributors and other clinical colleagues and researchers to really co-produce the direction of her research career. And as an outcome of the event, Cara is currently working on publishing an article outlining the results identified for the event, but is also working on a next step application for further funding to continue her work as a researcher alongside her clinical work. I want to introduce you to Hassan. Hassan works in the voluntary sector, is in work service lead, so he supports people who are experiencing mental health challenges and difficulties in ensuring that their work rights are respected and safeguarded. Hassan is a fantastic workers' rights supporter and has really great knowledge and understanding of lived experience in relation to mental health challenges. And as part of his career development fellowship, Hassan refined his skills to conduct scoping and systematic reviews. So has done loads of learning and loads of studying and loads of practicing as well. And for that practicing, he has developed a supervisory team network and is currently working on next steps for funding. And specifically, the focus of his research is around the experiences of moral injury and moral distress among health and social care workers from a minoritized background. and he's done loads of work already on creating a protocol for a systematic review. So watch this space because I'm sure I'll be publishing soon. Another fellow that I wanted to introduce us to is Tom. Tom is a children wellbeing practitioner, and his fellowship has taken a very interesting direction when Tom was awarded an additional fellowship as part of another arc. And he started focusing much more onto AI, and is currently looking at how AI can support an earlier diagnosis or intervention or prevention of mental health support and services, specifically with children and young people. So this is to give you an idea of how the fellowship develops whilst we are doing it as well. And then I wanted to introduce you to Nicola. Nicola is also a nurse, and she's also a patient safety specialist. She was one of our two postdoc fellows. So she had already completed a doctoral study. And through her fellowship, she really developed her role as research champion and supporter within her organization. So she really looked at understanding and figuring out a way to develop a network to support other nurses into research. We also have Pierre. Pierre is a dual diagnosis worker, and through his career development fellowship, he's also worked through a scoping review. So he's really developed a greater understanding of what literature is out there with regards to the barriers and facilitators of mental health service uptake, primarily working in dual diagnosis services. He's currently working on the next step of his research career with a supervisory team. So another person to watch his space for. On our last slides, we have Jason and IFA. Jason is a peer coach and trauma-informed collaborative lived experience practitioner. And Jason has been working on developing his proposal for next steps funding to really focus on trauma-informed peer coaching, and has done loads of work around networking and ensuring that he could develop a very solid and supportive network for his supervisory team. IFA, who is a specialist child and adolescent mental health pharmacist, was our first pharmacist engagement. We're very proud that IFA came through. One of the key points in IFA's experience as a fellow was her determination, I would say, and really wanting to ensure that pharmacists have a space in mental health research. And her determination meant that she had an idea, and that throughout her fellowship, she transformed the idea into a research proposal, and is currently looking at furthering her research career through applying to different follow-up steps. So this is to give you a bit of a sense of who has been a fellow for MHO so far. Loads of different backgrounds. Some colleagues with a background with previous studies. Some colleagues who had not engaged in any research for a while, had a strong interest in research and wanted to move forward. Before we move into MHO2, the last two fellows that I wanted to introduce you to are Urania, who is a therapy team manager and complex case therapist working with children and young people. And for our career development fellowship, Urania has worked on a PhD application looking at the connection between movement, body and mind in psychotherapy, with Urania being a movement therapist specialist. And Cassandra, who is a senior peer recovery tutor, also joined the fellowship as a postdoc fellow. So she had previously completed a doctoral study. And for her fellowship with MHO, Sandra has worked on developing a protocol for a study to understand intersectional trauma-informed recovery. And she's currently working on the study itself. So again, a broad variety of backgrounds, a broad variety of engagement activities and different outputs, but all brought together by a strong interest in combining their working mental health with developing and engaging with research, which hopefully is what brings you here and is what we are really keen to discuss and explore as part of MHO2. So I'm going to introduce you now to MHO2. Probably be another 10, 15 minutes of me talking, and then we'll have time for questions. And as I said before, this meeting has been recorded, so you will have access to the video for our website. So the aim of MHO2 is to grow bigger and brighter, I guess, to continue to maintain and expand the work across the North Thames and across England to really emphasize the importance that research capacity building has across a diverse range of staff groups. We want to continue developing our training and ensure that colleagues across different backgrounds and range of skills can access research. And when we talk about access, we are not simply thinking about the doing of the research, but also the reading and the applying and the incorporating in the daily experience of practice and services in relation to mental health. We also want to build on our successes with the Career Development Fellowships. And as such, we are going to be launching 2 different pathways of fellowships that I will tell you a bit more about in a moment. But just as a preview, we're going to fund a general cohort of fellows, so open to all staff members. And then we'll have a dedicated cohort for peer support and peer coaches as we recognize the crucial role that they play in bridging lived and living experiences with service provision. In terms of the training, very briefly, we're going to build on the training package that we built during MHO1. So we're going to be having trainings that focus on getting into research, so different pathways into research and developing research ideas to access funding. And this was a co-produced training with our colleagues from the advisory group and the fellows from MHO1. We're going to be delivering a training for staff research champion, again, emphasizing the importance that staff can play, not only in engaging and promoting, not only engaging with research, but also in promoting it. We'll have public and patient involvement and engagement in research. We'll have more ethics specific in mental health research. And then we'll have a session on cultivating a research culture within organizations. The fellowships are our exciting new element, or revised element, in fact. So we build the fellowships on our experience from the fellows that you've just met for the brief storytelling moment. In terms of the fellowships, as I mentioned before, we have 2 different pathways. We're going to be launching a pathway open to all staff, so anyone working in mental health in the North Thames region. So as I mentioned before, the North Thames region is roughly from Camden and Islington up to Essex on the north side of the Thames. We are specifically and emphatically encouraging applications from colleagues based in East London and Essex. And that's because these are the areas with the biggest gap between need for mental health support and provision and research engagement. We're also enthusiastically and emphatically encouraging applications from colleagues from minoritized backgrounds and from staff roles who have fewer opportunities or do not have a traditional route into research as part of their career progression. So as I mentioned earlier, for example, pharmacists is a good example. Nurses is a good example. Allied professionals is a good example. Therapists, depending their context, might be a good example. But also we have a dedicated peer support staff fellowship route, and that is for colleagues who are working or volunteering in a peer support role or coaching or lived experience role across England. Yes, we've gone national for this, and that is because we have the possibility of having more fellows, and also we want to really reach broader and develop a network of peer support researchers or peer researchers. So in terms of the fellowships, let's deep dive a bit more. So as I mentioned, we have these two pathways. The aim of both pathways is to develop research skills and competencies, and also to create something. So ideally, what we would want is for the fellowship to be, think of a bridge between where you currently are at in terms of your research career and the next step. So a great bridge in research is usually an application for further funding, okay? So that is why that's the aim that we encourage. However, we're open to conversation. I think it's important at this point to emphasize that the fellowship is not to conduct research. So you would not be conducting research within the fellowship. And that is because the way in which we operate as MHO is that we want to create space for thinking and for co-producing and for engaging. So this time is focusing on you and your development and the development of your idea so that it can be a successful and effective and impactful piece of research. As I mentioned before, for the pathway open to all staff, we are going to be recruiting around 6 fellows, and that is connected to the amount of funding that we received for this pathway and the average salary that we've somewhat calculated, but there's some flexibility. We are going to be giving priority to East London and Essex applicants. As I mentioned before, that is to do with the research gap between needs and research engagement. We appreciate that colleagues will come from different engagement with research, but because of the nature of the fellowship, a basic research understanding and experience will be required. So that might be from previous studies, from training that you've completed within your organization. There is flexibility with regards to the definition of this. So please do not let this be a barrier to your application. We are recruiting colleagues locally. So for this pathway, we strongly encourage in-person attendance. And when I say in-person attendance, I'm not talking the whole time. I'm just saying we want to be able to have that in-person conversation. We are going to be delivering in-person training. We are going to be having events and opportunities for you to shine at. So we would really want to have a flexible and hybrid approach, but there will be in-person elements. For the peer support workers and peer support coaches pathway, we have received a larger amount of funding, and in terms of salary as well, we've recognized that there are different bands. So we are looking at tentatively launch 10 fellowships. So that means that we're hoping to fund 6 people on the all staff groups and 10 people in the peer support group. For the peer support, we're going national. When I say national, this is within England. We don't necessarily need prior research experience, and that is to recognize the different pathways and journeys that lead to peer roles. And because it's across England, we can't really get you moving up and down every week or every other week. So it will be more of an online-based engagement, but we are looking at hopefully having 2 to 3 in-person events in London, for which we will fund your transport so that we can support you. But yeah, so there'll be more of a online element on the peer support pathway. So how the funding works, this is an interesting question because basically MHO as a program has received funding from the NIHR, just a reminder that's the National Institute of Health Research, to then fund the fellowships. So no, that was a false alarm, apologies. So the way in which the fellowships work is basically we receive the money and you apply and you ask your employer to calculate how much it will cost for them to release you for 1 or 1.5 or 2 days a week for 12 months. Important fact, all fellowships will be 12 months, and that's because we recognize that the amount of activities and the amount of processing time that is needed is across 12 months. There's some flexibility here and there, particularly on a one-to-one conversation. We're happy to chat on any need for flexibility. But we're really keen to try and develop a cohort approach as well, because we recognize that alongside research culture and time, sense of belonging and collaboration is key to developing effective research careers. So we really want to get the fellows to work together as a cohort. So the way in which it works is that, as I was saying, you ask your employer for a bulk figure of how much it will cost for you to be released for 12 months for 1 or 2 days. And that will have to be under £25,000. Again, flexible, but ideally that will guarantee that we can offer 6 different fellowships in the all staff pathway. And for the peer support staff will be, again, over 12 months, maximum of £20,000. And that guarantees that we can offer 10 fellowships. And if you are employed in a paid employment, what will happen is that your organization will provide us with the information of how much we need to cover for you to be released for the agreed time. And then the NHR Arknow Thames will transfer the money over and basically what is called a backfill of your time. So your organization will be paid. So there will be no impact on your salary. If you're volunteering, our marvelous colleague who's working on the finance team, and big shout out to Nadia for this, is currently working on identifying pathways so that we can open up our fellowships to colleagues who are currently volunteering. It is important that you are associated to an organization, and I'm going to tell you a bit more in a moment. But this is quite a shift for us. So apologies if we get things wrong. We are learning, but also thank you for all the feedback and recommendations that we received during MHO1, because that has really galvanized us to open up and find ways to be able to engage colleagues who are currently volunteering. And this is probably most relevant to colleagues who are in a peer support or coaching role. So that might be more important for that pathway. So that is a bit of how it works. So the idea is that this fellowship will not have a negative financial impact on you or your organization because your time will be covered by us. And in terms of the activities, as I mentioned, there's going to be loads of training. We recognize the importance of developing our understanding and competencies and skills. But fear not, our training tend to be very engaging and co-produced and collaborative. So it won't be just us talking at you. We try to avoid the us and them sort of engagement. We're going to work on developing a career plan so that the fellowship is a stepping stone. It's a starting point. It's a bridge. It's not an end. We're going to develop a fellowship or project proposal or funding application so that you can continue working with your career development. We are going to help you connect with a network of researchers, and I'll say a bit more about that in a moment, and also develop your core skills as a research champion. So one of those people is always happy to chat about research and is really enthusiastic about it and wants everyone to get engaged because we recognize the crucial role that research has in improving outcomes and access to services. And of course, you'll become part of our research network. You'll be part of the MHO network. So that is in itself a fabulous activity to engage with. In terms of the outputs, as I mentioned before, these are quite flexible, but the idea is around completing the training, so engaging with the training and having some kind of engagement output. It doesn't have to be a paper. I think we're moving more and more towards an academic understanding that published papers are not the only way to disseminate and exchange knowledge. So, for example, we're having events in which we're going to be sewing together with people and talk about kind mental health research. So, variety is what we're looking for and creativity is what we're looking for. We're going to be supporting you in developing a proposal for the funding, as I said, stepping stone, not the end, the career development plan, and then any other activities that might be of help to ensure that colleagues within your organization are also benefiting from your fellowship, so that it's a way for all of us to really emphasize and enlarge the importance of research and develop an effective research culture in our region and beyond. Why did I say that it's important that you're associated with an organization? Because we recognize the importance of having that connection with mental health services and practices and delivery and experiences. And also because we would like for the fellowship to work as a sort of starting point for you, but also for the people around you, so that your learning goes to impact other people and supports the development of other people. And for this, we would really like for your organization to help us identify someone within your organization to be a peer mentor or a supportive ally, so that when things might get a bit harder, you're not on your own within your organization. We will also provide you with an early career mentor. This will be either a doctoral student or early career researcher. And that is because we've learned from MHO1 that someone who's just gone through it or is just going through it has a wealth of knowledge on the how-to, on the practicalities. But you'll also be connected with either a topic or a method relevant senior researcher, so that you'll not just get the fresh info from someone who's going through the motions now, you also get the support of someone with experience. We will have reflective practice groups every other week, and we'll operate them in a combined structure across the work discussion group that happens in therapeutic environment and the reflective practice group. So it's a bit structured, but it's basically an opportunity for us to think together and grow together and support one another. And there will be dedicated session with public contributors to help shaping your ideas and projects. Again, as I said before, taking time and listening and incorporating and working and co-producing is crucial in our way of working. And of course, you'll get access to all of the amazing NHR Archnaut Thames offering, the academy courses, the ECR network, all the events, So there will be a lot in terms of connecting and networking with all of us. Let's get on to the timeline. I'm running out of time and I want to give a couple of minutes for questions. So we've launched today. The submission deadline is the 25th of November at 1 p.m. And we are going to be announcing the outcomes of the applications between the 12th and 13th of December, with the idea of then onboarding people who have been successful in their applications and for them to start around the 1st of March. Of course, with some flexibility, but we want to build in that time so that you have the opportunity with your organization to develop a plan to make sure that this works well, and also making sure that we can support you and that we start together as a cohort. What happens between then and now? So we have a lot of support. Again, I wanted to give a shout out and a thank you to all the colleagues who helped us co-produce the support packages and the application forms and the guidance forms. Thank you so much. Your contribution has been great. In terms of support, there's going to be another workshop, but it will still be with me, but it'll be very different from today, as in it will not be me talking at you for an hour. It will be questions and answers, particularly looking at the application. So we're going to go through the application together and we'll chat about things. And then you can book a one-to-one chat with me. If you go on the website, which I'm going to drop in the chat later on, you can schedule a conversation with me. We currently have a lot of slots between the 14th and the 17th of October. We will release more if needed. We also have an in-person event on the 23rd of October between 6:30 and 8:30 and 9. We're going to be at UCL, in one of my favorite places at UCL, at the Grand Museum, for a brilliant event in which you'll have the opportunity of hearing about MH1, learning about MH1, but also chat with lots of people around research ideas and how to develop kind of research. And alongside the chatting, there's going to be sewing. Don't worry if you cannot sew. I cannot sew, but it's fine. There'll be lots of different art activities because we recognize that conversations flow better when we're doing something that we enjoy or that we're learning doing. We also are offering the review of a draft element of your proposal, and specifically we're going to be reviewing your research proposal. And that's because we appreciate that it's only fair to engage with research collaboratively. So why not helping you whilst doing the applications? You can submit the draft by the 21st of October. We'll need a couple of weeks to go through it. We have our marvelous colleagues within the Arknote Hems supporting us in the process, and then we'll return them to you on the 4th of November. So yes, we have a lot of support. Hopefully, I think it's 8 weeks from now to the submission. 1, 2, 3, 4, 5, 6, 7, 8 weeks will give you enough time to have those conversations with your manager, with your colleagues, to get your research juices going, to have chats with me, to attend the workshop next week, to hopefully attend our event on the 23rd of October if you can come in person. Unfortunately, that event will only be in person because of the nature of what we're doing. But yeah, so there are lots of opportunities to engage with us. And here is a bit of the summary. I will be sending you a copy of the presentation so you can have it, but you can also find all these information on the website. So please do go to the website, admire how gorgeous it looks, thanks to Katie, and then get in touch. I have gone way over my time and I do apologize. I'm going to stop sharing and then I'm going to stop recording